back to another episode of the Real Health Podcast. Our aim is to add as much value to you in your health journey, not only for you, but your entire family. And so we try to do this in 15 to 20 minutes to give you a commuter-style podcast that emphasizes prevention rather than reactivity. We are passionate about helping people live the life that God's called them to, which is, according to my belief, it's John 10:10, which means you're called to live an abundant life. So today we're going to talk about two things. The first is going to be COVID vaccine-induced effects, so side effects, and then long-haul COVID syndrome. So when COVID has its effects, the viral load has its effects in the body for an extended period of time. People now, years later, are dealing with a persistent inflammatory response in their body, and they don't have answers. So today we're going to provide those answers for you. Now, this is practical in many levels. So even if you're not dealing with long-haul syndrome, okay, this will be practical because it's a season where viral loads can have a greater effect in some people, whether it's a coronavirus, a C virus, or whether it's influenza virus or any other virus. So how do we negate the effects of those viral loads post-infection? And how do we resolve the inflammatory issue to get back to our healthy functional state as soon as possible? That's why it's going to be practical for you, whether you are dealing with a long-haul syndrome associated with coronavirus or not. How to address viral infections. You'll learn a ton in today's episode. Super exciting news coming up we wanted to share with you as well. When we look at the calendar of December, we've got an event coming up. So December 8th at 6:30 p.m. at our South office here in Knoxville, Tennessee, we are going to be hosting a Raising Healthy Children workshop. Now, it's not just going to be me, but it's also going to be a friend of mine here in town, Dr. Clark, who's going to be an up-and-coming pediatrician who's opening a practice in 2026, and we're going to be highlighting how to raise healthy children from a chiropractor standpoint and a pediatrician standpoint. So we can't wait. You can learn more about that by going to our social media page and Instagram at Real Health Co. and learning more about when the event is, how to sign up, how to register, but keep an eye on that. That's December 8th, 6:30 p.m. at our South office. Check it out. Okay, let's get into it. Let's talk about the effects. Now that we're years past COVID vaccines, let's talk about the data that's now presented as, hey, if you're having some of these symptoms, it could be linked to the vaccine that you potentially took. So what are we seeing? What are we observing in our culture, not just America, but throughout the world associated with COVID-19 vaccines? Well, there's obviously a short-term side effect. That could be as simple as a little bit of like redness at the injection site, or a fever, or maybe some muscle aches. But we're going to talk more about the adverse events that occur after it. And one of the biggest things that we have seen is really myocarditis and pericarditis. So we're seeing this inflammatory issue around the heart that mainly occurs within men under the age of 30. That's where young males were affected the most. And it most often happened after the second dose of an mRNA vaccine. And there's been multiple monitoring systems from the US, Europe, Israel, that show a real causal link between mRNA vaccines and myocarditis and pericarditis. And so when we look at this large review of data, it shows that these cases of myocarditis are presenting after an mRNA COVID-based vaccine. And so the symptoms are typically chest pain, shortness of breath, and palpitations. And if you address it soon enough in its development, then a lot of times you can offset the effects. But later in this podcast, we're going to talk about how to affect, if that is you, if you've had that episode, how to calm down the inflammatory response within the myocardium. The second thing that we've seen is thrombosis or thrombocytopenia syndrome. And this is mainly linked to the adenoviral vector vaccine. So this is the AstraZeneca vaccine. And this is a clotting disorder that is also presented, not just clotting disorder, but with low platelets. And because of this, many countries have actually restricted or stopped the usage within younger age groups because it was higher risk in younger adults, particularly females. So females were more susceptible to thrombosis or thrombocytopenia syndrome. There is another side effect that we've seen, and this is more of the anaphylactic response or severe allergic response. We've seen Guillain-Barré syndrome. This is where it is mainly attacking the central nervous system. And we see that other serious events have been like hepatitis, kidney injuries, and then one of the biggest things that we're seeing, in my opinion, is the autoimmune factor, right? So this autoimmune phenomena where we're getting from COVID vaccine, we're getting a secondary autoimmune response, and now even symptoms like tinnitus and ringing the ears or loss of hearing has been associated months and years later after a COVID vaccine. But particularly the autoimmune phenomena is something that's of super interest to me because we're seeing that show up not 6 months or a year or 2 years later. We're seeing it 3, 4, 5 years later where this sub-level amount of autoimmunity, this inflammatory immune response is happening years into the process. And so what we need to do is really address this from a immune inflammatory response. So whether you've had multiple vaccines or you haven't and you've had the viral load, like I got hit hard with COVID, hammered, and thought I was dying for probably like 5 days back early in 2020, in January of 2020. If that was you and you're still dealing with the effects of that, or you've had COVID vaccine-induced side effects, we're going to talk now about how do we resolve this inflammatory issue. So let's get into the root cause of, first off, long COVID. And what we see is, number one, it's a viral persistence. So studies show that the SARS-CoV-2 protein can persist in gut tissue. It can exist in nervous system tissue and the blood itself. That circulating spike protein is constantly keeping the immune system on alert. Number two is not only is the virus itself persistent, which means it's never going out. It's like a fire that's never ending. Number two is that it has been shown to create mitochondrial dysfunction. And this is specific to the metabolic systems of the body. So your mitochondria's job is a power plant. It's to drive energy, particularly ATP production. And so when we're looking at a issue associated with viral persistence, the inflammatory effects within the mitochondria are driving a sluggish metabolism. And what this does is it significantly affects your body's ability to make ATP. And so we see impaired mitochondrial energy production. We see low tolerance to exertion. So your gym workout vibes are just not there. We see lactate buildup, right? Because again, without ATP energy, we can't continue a particular activity for long periods of time. And this can even show itself in brain endurance. And then high oxidative stress, which is what we would call free radical damage. Number three is it's causing microclotting. So long COVID has been shown to cause microclotting and endothelial inflammation. So inflammation within the vascular system. With this, we get decreased oxygen delivery and we get increased fatigue and increased brain fog. So if you've noticed significant brain fog over these last couple of years and you've had the virus or the vaccine, it could be long COVID. We're seeing a lot of dysautonomia. So dysautonomia would be a term that we use to describe a dysfunctional autonomic nervous system. So high heart rate, tachycardia, temperature dysregulation. The GI system gets sluggish, constipation, and anxiety. These are symptoms that you could be dealing with long COVID. And then immune dysregulation. So we see increase in anti-nuclear antibodies, so we call that an ANA, thyroid peroxidase antibodies, so thyroid autoimmunity, and then increase inflammation levels. So what now resolves that, right? What are therapies proven to resolve long COVID and these symptoms? Number one, chiropractic care. Chiropractic care has one of the greatest effects on the parasympathetics, or the part of the nervous system that helps calm down, resolve dysautonomia. So when we look at dysautonomia, we can address that from a chiropractic model. And here actually at the Real Health Code, not only do we address it from a chiropractic model, the adjustment, but one of the most powerful strategies I've seen in being in practice almost 20 years is that we use a medical laser. We use photobiomodulation to increase oxygen delivery to the brain. And this has been dramatic for neurodegenerative conditions like Alzheimer's dementia, but also brain fog and dysautonomia. We've seen it even in its effects in ADD, ADHD. So chiropractic care combined with a medical laser has been absolutely foundational in these long COVID patients. Really anyone that's dealing with central nervous system dysfunction or dysautonomia. Number two, you've got to repair the mitochondria. And we do that through specific nutritional supplementation. Some big ones is you got to get CoQ10 in the body, right? You got to get some alpha lipoic acid. And one of my favorites, and I talk about it all the time, creatine monohydrate. 5 grams of creatine monohydrate a day helps regenerate ATP production. Number 3, we've got to keep a healthy clotting system. So we use systemic enzymes on an empty stomach to help the clotting system of the body. One of my favorites to use is what we call nattokinase, serrapeptidase. Taking enzymes on an empty stomach, not digestive enzymes, but proteolytic enzymes, can have a profound effect on clotting of the body. And then the other things, we use high dosage omega-3 fatty acids. We'll run a panel, look at their omega-3, 6s, and 9s, and we'll see what the ratio is. And then increasing omega-3 fatty acids is one of the best ways to improve endothelial function and create a reduction of inflammation. Make sure you're supporting the nervous system. Salt is one of the best ways to do it. Electrolytes is one of the best ways to do it. Getting into saunas, breath work will help as well. And then 4, you got to treat the virus, right? The persistent viral load. So looking at antivirals like olive leaf extracts and monolaurin, looking at fasting, right, to help reset the immune system, getting into ketosis, as ketones are phenomenal fuel for the brain, but also act as an antioxidant to the immune system and to the nervous system. Berberine is great to induce autophagy. So treating the viral loads, vitamin A, vitamin D, right, fat-soluble vitamins are very effective as well. And then reduction of inflammation. And one of the 2 biggest anti-inflammatories that I use on a daily basis is curcuminoids and resveratrol. My favorites from a company called Apex Energetics. Curcumin and resveratrol are 2 very potent polyphenols that reduce inflammation and have been shown to be so effective at helping long COVID. When you look at this, vaccine-induced or viral-induced long COVID, right, addressing inflammation, addressing the nervous system, right, addressing the viral persistence, blood clotting. When we do that, we can get some help, right? We can get some resolution of symptoms. I think a lot of people are walking around and they maybe not be associating their condition symptoms with long COVID. But if you're having brain fog, over the last few years, you've developed brain fog, low energy, inability to have great exertion, so early exertion in your workouts. If you notice a dysregulated nervous system like tachycardia or POTS syndrome, this could be linked to long COVID. If it is, there's solutions for you. And you can go to our website, realhealthco.com, and under the resources tab, go to long COVID, and you're going to see the solutions laid out for you with recommendations in terms of supplementation, the exact amount to take. So make sure you check out the website. And then please, if this is you, seek a provider's help, right? Well, if you live in Knoxville, come to the office and we can help, right? There are physicians out there that are trained to help you resolve this issue before it becomes a chronic autoimmune inflammatory issue that's now affecting multiple systems of the body. So there is hope and there's healing available to everyone that starts to put kind of the pieces of the puzzle together. So I pray this was a blessing for you. Make sure you check out our social media page for updates on the workshop December 8th. We're super excited about raising healthy children. Thanks for listening to another episode of the Real Health Podcast. Our passion is to add value to your healthcare journey. Anything that we do, we want to do it within a community to help as many people as possible. Thanks for listening to episodes of the Real Health Podcast. If you could subscribe, and you can share, it would help our mission to reach as many people with real health that produces real results for real people.